Hello, everybody. I'm Jamie-Lynn Sigler. I feel really liberated just being able to speak my truth. And I think that the more visibility and the more that we talk about these things, the more the stigma gets erased, the more shame gets erased. You never want to be a burden. You never want to be a problem. I hid my RMS for 16 years because I wasn't sure how it was going to be perceived. Before I went public with my relapsing MS diagnosis, I finally confided in my castmates who were nothing but supportive and even encouraged me to share my story. I just wasn't ready at that time. I think that accepting things that are hard has been one of the biggest lessons of RMS, and I think that that's definitely something I'm passing down to my kids. So in the beginning stages of motherhood, I wanted to do it all. I wanted to prove that I could do it all. I didn't want anybody else helping me. My husband played baseball in the first 3 years of my son's life, so he was gone all the time. And I really burned out. And I really learned a hard lesson. I was just so afraid, to be honest, of being replaceable. And, with any mother that I've ever known, the guilt and those types of feelings are very real no matter what you're dealing with. But if I am having a hard day, I'll let them know. I think that it's really allowed in our home a really safe space to just share whatever you're going through. So especially for two little boys, we talk about emotions and feelings all the time. So as you can imagine, living with MS for 22 years, I've been in a lot of different doctors' offices. And my neurologist, my MS specialist, who I started working with about 8 years ago, he said to me in our first sit down, what do you feel? What do you want? And that was such a relief because I think you can feel like you're not in control of your body and your choices. And I think it's incredibly important to advocate for yourself, especially when it comes to your RMS and with your MS specialist. My doctor likes to say your voice should be the loudest in the room, and it is. Speaking what would be best for me is what led us to KESIMPTA and allows me to feel like I have some control over my health. KESIMPTA works perfectly into my life and schedule. The fact that I take it once a month on my own, I can stay on top of my treatment whenever I'm traveling for work with my kids, and I'm really grateful that it was the treatment that my doctor and I decided on for me. With something like RMS, you might not know exactly how it's going to manifest for you, but with the support and the right MS specialist and people around you, you will have the team to help you through that. And then reach out. Asking for help is really hard for a lot of moms, a lot of women, a lot of humans, but it's important, and I've learned the beauty in that exchange. My girlfriends in general, all through these years, they have been so supportive of me. They've been encouraging me to talk about the hard stuff. They've also been there to remind me that they don't see MS when they look at me, and that my value of a person and who I am is still the same. My journey with MS has really solidified my village big time. We're all pushing through, we're all persevering, we're all dealing with things that are hard. And I think that the more we share and the more that we connect, the less hard it can be.
Indication. What is KESIMPTA, ofatumumab injection? KESIMPTA is a prescription medicine used to treat adults with relapsing forms of multiple sclerosis, MS, including clinically isolated syndrome, CIS, relapsing remitting disease, and active secondary progressive disease. It is not known if KESIMPTA is safe or effective in children. Important safety information. Who should not take KESIMPTA? Do not take KESIMPTA if you have an active hepatitis B virus, HBV infection, have had an allergic reaction to ofatumumab or life-threatening injection-related reaction to KESIMPTA. What is the most important information I should know about KESIMPTA? KESIMPTA can cause serious side effects, such as infections. Serious infections which can be life-threatening or cause death can happen during treatment with KESIMPTA. If you have an active infection, your healthcare provider, HCP, should delay your treatment with KESIMPTA until your infection is gone. KESIMPTA taken before or after other medicines that weaken the immune system may increase your risk of getting infections. Tell your HCP right away if you have any infections, or get any symptoms, including painful and frequent urination, nasal congestion, runny nose, sore throat, fever, chills, cough, or body aches. HBV reactivation. If you have ever had HBV infection, it may become active again during or after treatment with KESIMPTA, reactivation. If this happens, it may cause serious liver problems, including liver failure or death. Before starting KESIMPTA, your HCP will do a blood test to check for HBV. They will also continue to monitor you during and after treatment with KESIMPTA for HBV. Tell your HCP right away if you get worsening tiredness or yellowing of your skin or the white part of your eyes. Progressive multifocal leukoencephalopathy, PML. PML may happen with KESIMPTA. PML is a rare, serious brain infection caused by a virus that may get worse over days or weeks. PML can result in death or severe disability. Tell your HCP right away if you have any new or worsening neurologic signs or symptoms. These may include weakness on one side of your body, loss of coordination in arms and legs, vision problems, changes in thinking and memory, which may lead to confusion and personality changes. Weakened immune system. KESIMPTA taken before or after other medicines that weaken the immune system could increase your risk of getting infections. Before you take KESIMPTA, tell your HCP about all your medical conditions, including if you have or think you have an infection, including HBV or PML. Have ever taken, currently take, or plan to take medicines that affect your immune system. These medicines could increase your risk of getting an infection. Have a history of liver problems. Have had a recent vaccination or are scheduled to receive any vaccinations. You should receive any required live or live attenuated vaccines at least 4 weeks before you start treatment with KESIMPTA. You should not receive live or live attenuated vaccines while you are being treated with KESIMPTA and until your HCP tells you that your immune system is no longer weakened. Whenever possible, you should receive any non-live vaccines at least 2 weeks before you start treatment with KESIMPTA. Talk to your HCP about vaccinations for your baby if you use KESIMPTA during your pregnancy. Are pregnant, think that you might be pregnant, or plan to become pregnant. It is not known if KESIMPTA will harm your unborn baby. Females who can become pregnant should use birth control, contraception, during treatment with KESIMPTA and for 6 months after your last treatment. Talk with your HCP about what birth control method is right for you during this time. Are breastfeeding or plan to breastfeed. It is not known if KESIMPTA passes into your breast milk. Talk to your HCP about the best way to feed your baby if you take KESIMPTA. Tell your HCP about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. How should I use KESIMPTA? See the detailed instructions for use that comes with KESIMPTA for information about how to prepare and inject a dose of KESIMPTA and how to properly throw away, dispose of, used KESIMPTA sensor-ready pens or pre-filled syringes. Use KESIMPTA exactly as your HCP tells you to use it. Your HCP will show you how to prepare and inject KESIMPTA the right way before you use it for the first time. Do not inject into areas where the skin is tender, bruised, red, scaly, or hard. Avoid areas with moles, scars, or stretch marks. KESIMPTA may cause serious side effects including injection-related reactions. Injection-related reactions are a common side effect of KESIMPTA. Injecting KESIMPTA can cause injection-related reactions that can happen within 24 hours, 1 day following the first injections and with later injections. There are 2 kinds of reactions. At or near the injection site, redness of the skin, swelling, itching, and pain. Talk to your HCP if you have any of these signs and symptoms. That may happen when certain substances are released in your body. Fever, headache, pain in the muscles, chills, tiredness, rash, hives, trouble breathing, swelling of the face, eyelids, lips, mouth, tongue and throat, and feeling faint or chest tightness. Contact your HCP right away if you experience any of these signs and symptoms, especially if they become worse or you have new severe signs of reactions after subsequent injections. It could be a sign of an allergic reaction, which can be serious. Low immunoglobulins. KESIMPTA may cause a decrease in some types of antibodies. Your HCP will do blood tests to check your blood immunoglobulin levels. Liver damage. KESIMPTA may cause liver damage. Your HCP will do blood tests to check your liver before you start KESIMPTA and while you take KESIMPTA if needed. Tell your HCP right away if you have any symptoms of liver damage, such as yellowing of the skin and eyes, jaundice, nausea, vomiting, unusual darkening of the urine, feeling tired or weak. The most common side effects of KESIMPTA include upper respiratory tract infection with symptoms such as sore throat and runny nose and headache. Headache. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see full prescribing information, including medication guide, on this site or at www.kesimpta.com.